Well, the meniscus is actually a C-shaped bushing or shock absorber in the middle of the knee. And the most common way that people tear it is with everyday activity. When they bend, squat down to go pick up a sock or put on a shoe, and they go to get up, and the meniscus or the cartilage is pinched between the two bones, the femur and the tibia. And they'll feel or hear a little pop or squash in the knee, and that it was actually the tearing of the meniscus. Certainly you see the big dramatic tears on the sports field when somebody goes to run and plant and cut and they have a twisting injury to the knee. When we actually get to surgery for a torn meniscus, the decision as to what the ultimate fix for this problem is really determined by a number of factors. One, what does the tear look like? Some people just really destroy the meniscus and it kind of looks like crab meat. Those you can't put a stitch in it, okay, and we have to trim back. We only trim as much as is unstable, trying to preserve as much as we can. But if there is actually a tear and the main body of the cartilage is relatively well preserved, and if it's around the periphery or the outer margin of the cartilage where the blood supply is, we usually try to repair those. Well, when it comes to repairing a meniscus, we have a number of options available, but really what it all comes down to is you need to put a stitch or a suture into the meniscus. Now we have techniques where we can do it all inside the knee joint, doing it all arthroscopically, which is what most of us do now. But also there are techniques where we can do part of it on the inside, but then make an incision on the outside of the knee to retrieve our sutures or to put them in. Or there's what's called an all-outside technique, where you just actually make an incision and get down to the knee joint itself where the meniscus is, and then put stitches in that way. There's a big difference in the recovery period for repairing a meniscus, meaning putting sutures or stitches in it, versus trimming one back or debriding it. The trimming back is a relatively quick recovery because we're not waiting for anything to mend together. We can get you moving right away. People are on crutches for 1 to 2 weeks. They're doing reasonably well by about 6 weeks, but there's still some swelling in the knee. It takes about 2 to 3 months to fully forget about trimming back a meniscus. Repair, on the other hand, is much longer recovery period. It takes 6 weeks to try to get the meniscus to scar together, so we need to have you on crutches for 6 to 8 weeks. And then we progress slowly with getting back to sport-specific types of running and cutting, which can start anywhere from 6 to 9 months later.